Hello, everybody. Welcome. Today we're going to talk about nutraceuticals and psychopharmacology, specifically how they interact, especially across diverse populations. I'm going to explore not only what works and what's evidence-based, but also how individual patient characteristics, such as renal function, pregnancy, and ethnicity, shape our prescribing. Let me apologize to you, coming to you from a Starbucks, so you're going to hear some background noise. But I'm traveling and I needed to record this lecture. So hopefully it's not terribly distracting. The subtitles may help. So let's get right into this here. We're talking about nutraceuticals. Let's define this. Let's define some key terms. Nutraceuticals are a subset of dietary supplements, often marketed for mental health benefits. Think things like omega-3s for depression or GABA for anxiety. Unlike pharmaceuticals, most are not FDA approved for efficacy or safety, so this creates risk. Products vary in potency and purity, and patients often assume nutraceuticals mean safe. So have you ever had a patient ask about supplements they have found online? What did you say, and what did you base it on? Given the variability in supplement quality, how can you verify safety and potency? So consider this case, for example, a patient with a renal disease is using magnesium for sleep. The key concept here would be focusing on excretion because most things are excreted in the kidneys. Impaired kidneys can't clear magnesium efficiently, which can lead to toxicity. Think clinically in these situations, things like, say, magnesium, lithium, or other renally excreted substances require caution, and always tie the supplement safety to the patient's organ function. So what other over-the-counter supplements might accumulate in patients with kidney disease? What comes to mind? Think of the common things that you may have heard about. Now, some supplements have real evidence. For example, omega-3s have a moderate support for mood disorder, as does St. John's wort, also effective for mild depression. But this interacts dangerously with SSRIs and things like birth control. Another thing to consider is the dosage. For example, vitamin E at high doses can increase stroke risk. Remember, more is not always better. So which of these would you feel most comfortable recommending and why? The primary concern in combining St. John's wort and SSRIs is this risk of serotonin syndrome, which is a potentially life-threatening condition caused by excessive levels of serotonin in the body. Symptoms of serotonin syndrome can include things like agitation and confusion, rapid heart rate, high blood pressure, dilated pupils, muscle rigidity, and in severe cases, it can lead to seizures or loss of consciousness. St. John's wort can also induce various liver enzymes, specifically CYP3A4, which can decrease the effectiveness of other medications by increasing their metabolic rate and clearance from the body. So they may have been therapeutic, they're supplementing, trying to make things better with St. John's wort, and suddenly they're no longer therapeutic because the pathway has been induced. Similarly, something like vitamin E has anticoagulant properties, meaning it can inhibit platelet aggregation and prolong bleeding time. The problem with that, of course, when combined with SSRIs, which are also known to have that adverse effect, can increase the overall risk of bleeding. There's another category of supplements or nutraceutical on the market called the adaptogens. These are natural substances, often derived from plants or herbs, that are claimed to help the body adapt to stress and exert a normalizing effect on the body's process. They are thought to enhance the body's resilience to physical, emotional, and environmental stressors. The concept of adaptogens originates in traditional medicine, in non-traditional medicines such as Ayurveda and traditional Chinese medicine. But this has lately gained popularity with the advent of social media. Adaptogens are said to work by modulating the stress response, potentially affecting the hypothalamic pituitary axis, which regulates the body's reaction to stress. They may also influence neurotransmitter systems and immune function, aiming to restore balance and promote overall well-being. A popular supplement is ashwagandha. Now, some studies suggest that ashwagandha may reduce stress and anxiety, and it's believed to lower cortisol levels, which is like all the rage these days, the hormones associated with stress. Keep in mind, cortisol is an adaptive hormone. We secrete it for a purpose. Preliminary research indicates that ashwagandha may improve symptoms of anxiety and stress, but the evidence is limited by small sample sizes and varying study qualities. So again, your psychopharmacology research skills need to come into play. It needs more rigorous large-scale studies that are needed to confirm its efficacy. There's another supplement that's quite popular. It's called rhodiola, rhodiola rosea. Rhodiola is often used to combat fatigue and enhance mental performance. Some studies have shown that it may reduce fatigue and improve cognitive function under stress. However, similar to ashwagandha, the evidence supporting its effectiveness is less than robust. And while well-designed clinical trials are necessary to establish these benefits conclusively. All the rage now, from your local soda to your yogurts to your over-the-counter supplements, the gut microbiome is becoming the new focus of attention. The gut-mind, gut-brain connection is all over the health media. The gut microbiome basically consists of trillions of microorganisms residing in gastrointestinal tract. The gut-brain axis, which is this bidirectional communication network linking the gut and the brain. The gut microbiome can influence mental health through several mechanisms. First, neurotransmitter production. In fact, you'll think that serotonin is secreted in the brain, but really it's a gut secretion. Certain gut bacteria can produce neurotransmitters such as serotonin, dopamine, gamma aminobutyric acid, GABA, which all play key roles in mood regulation. Another function of the gut microbiome is immune system modulation. The gut microbiome can affect the immune system, influencing inflammation levels in the body. Chronic inflammation has been associated with mood disorders like depression and anxiety. Metabolic pathways of the gut bacteria produce short-chain fatty acids and other metabolites that can impact brain function and behavior. Also, the gut microbiome is involved in vagus nerve signaling. Vagus nerve provides a direct communication pathway between the gut and brain, allowing for gut microbiota to influence brain functions and vice versa. You've heard of probiotics and now prebiotics. Well, these are non-digestible food components such as fibers that promote growth and activity of beneficial gut bacteria. These serve as food for the probiotics and can be found in foods like onions, garlic, bananas, and whole grains. Probiotics have had the spotlight for some time. You'll even see it in pop soda. These are live microorganisms that, when consumed in adequate amounts, confer a health benefit to the host. Probiotics are found in fermented foods like yogurt, kefir, sauerkraut, kimchi, but you can also buy the supplements. If you do buy them, though, you do need to refrigerate them. Otherwise, the temperature extremes can kill them off and you can lose benefit. Probiotics and mood disorders. Some studies do suggest that certain probiotic strains have beneficial effects on mental health, potentially reducing symptoms of depression and anxiety. These effects are thought to be due to the modulation of the gut-brain axis and the immune system, affecting the neurotransmitter production. The current evidence is promising, but very preliminary. The evidence is not yet robust enough and ready for prime time to make general recommendations for primary treatment of mood disorders. That doesn't stop people from doing it, though. The efficacy of probiotics can vary depending on strain, dosage, and what your individual characteristics are. So what do we do with all this information? Well, probiotics may be considered as an adjunctive treatment for mood disorders, especially for a patient interested in the complementary approaches or for those who experience gastrointestinal symptoms along with mood issues. However, it is important to choose products with specific strains that have been studied for mental health benefits and to use them under similar guidance of a healthcare provider. In summary, while probiotics do show potential for supporting mental health, we still need more rigorous studies and the need to establish their role in treating various mood disorders. So we really need to consider what the needs are, what is the current evidence, what is the risk versus the benefit. Now, uh, something like St. John's wort can decrease the effectiveness of oral contraceptives, potentially leading to unintended pregnancies. This interaction does tend to occur because St. John's wort induces the activity of certain liver enzymes, specifically in the CYP450 and specifically the 3A4 strain. But increasing the activity of 3A4 accelerates the metabolism of estrogen and progestins, and the active ingredient in many oral contraceptives, and thereby reducing their level effectively in the bloodstream. Other supplements that alter drug metabolism include things like grapefruit juice. This is a known inhibitor of the 3A4, leading to increased levels of certain medications, such as statins and calcium channel blockers. But interestingly enough, if you happen to be on a sedating med like a benzodiazepine, you may find that you're more sedate later on after, consuming the grapefruit juice and still having to inhibit the metabolism of that drug. Garlic, on the other hand, induces certain enzymes, potentially reducing the effectiveness of drugs, antivirals, and anticoagulants, because it induces the pathway. Ginkgo biloba, very popular, affects the 2C19 and the 3A4, and this alters metabolism of drugs such as anticoagulants and antiplatelet agents. Echinacea used to be all the rage. I've not seen this around much, but it can both inhibit and induce different CYP450 enzymes and can affect drugs like immunosuppressants and statins. Now let's talk about pregnancy and how this can affect metabolism of various medications. So we talk about teratogenic effects, and this is really what we're worried about. Neural tube defects specifically. So all women of childbearing age, if they're going to be on valproic acid, should have it co-prescribed with oral contraceptive or have a more definitive form of preventing pregnancy. Valproic acid significantly increases the risk of neural tube defects such as spina bifida in the developing baby fetus. Other congenital malformations can occur. There's increased risk of other congenital malformations such as craniofacial defects, cardiovascular anomalies, and limb malformations, depending on when in the gestational period these products are taken. Children exposed to valproic in utero may have increased risk of developmental disorders, including lower IQ scores, increased risk of autism spectrum disorder. So due to this, we generally don't want to give valproic acid to women of childbearing age. So what do we give them? Generally, lamotrigine is considered the preferred mood stabilizer in pregnancy with bipolar disorder. It has a more favorable side effect safety profile than valproic, but it does carry risks of congenital malformation, and the overall risk is lower, but it is not zero. So close monitoring and dose adjustments are going to be necessary, especially as the pregnancy progresses. Remember, volume distribution goes down as you progress through the later stages, so the dose will need to be adjusted. And what about lactation with psychotropic medications? Well, these special populations, there is a safety threshold, recommended ingestion dose of less than 10% is generally considered to be of low concern for most medications, indicating that the drug is unlikely to cause adverse effects in breastfed infants. Now, this is all derived. There is a quantitative measure that can be done to assess the potential risk of a drug exposure to the infant. The lower the RID, this suggests lower risk, which can maybe help you in deciding what to prescribe to a mother that is lactating. This also can be used alongside your clinical judgment and available safety data and past history of what has worked in the client about continuation or initiation of psychotropic meds and breastfeeding to ensure both safety for both individuals. Now, these are all helpful tools, but other factors need to be considered. So RID of 0.7% is well below the 10% threshold generally considered safe. And you can go online for an RID calculator to help you determine what might be safe and effective to figure out what the exposure to the infant will be. The clinician can also reassure the mother, with sertraline. This is most commonly prescribed SSRI. It's everything has a risk benefit analysis. So we have to keep in mind what we're going to choose. The mother is so depressed and unable to bond, that's going to affect too. Lactation and psychotropic meds. Why sertraline is the preferred SSRI? It's the one that's most commonly used, and it has the lowest milk to plasma ratio, meaning that only a small amount of the drug passes into the breast milk. Minimal infant exposure. Some studies have shown that sertraline results in minimal exposure to the infant with undetected serum blood levels in the infant that has been breastfed. It's one of the most common and most studied, so that's why it's the most widely selected. What about sex differences in psychopharmacology? Well, the menstrual cycle can definitely affect the different phases of how drugs are cleared and enzyme activity. Pregnancy increases the volume of distribution and alters its activity of hepatic enzymes. This often leads to increased metabolism of the drug. And of course, menopause, changes in hormone levels during menopause can alter drug metabolism, potentially requiring dose adjustments. Men generally have higher body mass index, the muscle to fat ratio. And so that can influence the volume distribution for certain drugs. Liver enzyme activity, meant to have higher baseline activity of certain liver enzymes and involved in drug metabolism. So this can lead to faster clearance, and also have different receptor sensitivities and neurotransmitter systems between men and women can vary differently. That can affect efficacy. Now, do you consider this? Most do not. Most just pick a drug and titrate accordingly, but it's something to be in mind physiologically. Women also tend to metabolize drugs like zolpidem slower than men. That leads to a higher blood concentration, increased risk of next day impairments such as drowsiness, and impaired driving ability. As a result, the FDA has recommended lower doses for women compared to men. Something else to keep in mind, SIADH is more common in women, subject to hormonal influence. So estrogen can enhance the activity of antidiuretic hormone, making women more susceptible to water retention, hyponatremia, which is the hallmark symptom of SIADH. Body composition also, women generally have a higher fat to lean body mass, and this affects fluid balance, potentially predisposing them to hyponatremia. Women also experience different pharmacokinetics with antidepressants, which can lead to higher plasma concentrations and increase the risk of adverse effects, like SIADH. Now, there are geriatric considerations to consider. As you know, the elderly have slower metabolism, and drugs with long half-lives will take even longer to clear. So diazepam has active metabolites with long half-lives, which can lead to accumulation and increased sedation and risk of falling. The other thing is elderly have more sensitivity to benzodiazepines, which can exacerbate cognitive impairment and increase the risk of delirium. And long-term use can lead to physical dependence, and then you have to contend with withdrawal management symptoms in someone which may have a lot of comorbid conditions, which can be particularly challenging in older adults. The age-related decline in liver function can slow the metabolism of diazepam further, contributing to the accumulation. So what's the preferred alternative for anxiety or insomnia in the older adults? Insomnia in older adults, we prefer non-benzodiazepines as their first-line agents. But when medication is necessary, SSRIs, escitalopram has a better safety profile. Buspirone is nice, but it takes a long time to kick in and it doesn't cause sedation. Melatonin's not a bad suggestion, such as Ramelton, which may have minimal side effects. And then also low-dose trazodone, occasionally used for the sedative properties. But as always, caution, start low, go slow. Now, what about antipsychotics? Well, believe it or not, the safest one for at least Parkinson is clozapine, but you know that comes with another host of complications and frequency and monitoring, like agranulocytosis. Pimavanserin is also something to consider. It's approved for Parkinson's and psychosis. It doesn't worsen the motor symptoms. It's favorable with respect to 5-HT2A receptors, and it doesn't significantly affect the dopamine receptor. The most commonly used, because it's more readily available, it's generic and you can start quite low, is quetiapine. It's a weaker D2 antagonist, and it's the most readily available, doesn't require prior authorizations. And the goal is to hopefully not stay on them long term. Now, what can we say here about vitamin deficiency? Which vitamin deficiency is most associated with depression? A, vitamin A, B, vitamin C, C, vitamin D, or D, vitamin K? Well, what do you think? Vitamin D has the strongest evidence linking deficiency to depression, although vitamin B6, 9, and 12 also play key roles. Limited sunlight exposure, as many psychiatric patients don't get outside as much, tend to have low vitamin D levels and can exacerbate symptoms of depression, anxiety, and psychosis. So supplementation can be effective. Poor nutritional intake, which is not uncommon among individuals with severe mental illness, can also contribute to lower levels of vitamin D. And medication side effects. Some psych meds can contribute to weight gain and sedation, leading to decreased physical activity and outdoor exposure, thereby further lowering vitamin D levels, especially in the institutionalized patient. Low vitamin D levels further exacerbate things such as hypercalcemia, which can cause symptoms such as nausea, weakness, and serious complications like renal impairment. So for that reason, we need to be careful and monitor vitamin D levels, especially in the more compromised patients, and supplement accordingly. What about herbal supplements? A patient taking kava for anxiety reports feeling excessively sedated. Well, kava has been associated with liver damage, ranging from mild liver enzyme elevations to severe liver failure, which can necessitate liver transplantation in extreme cases. Kava should not be combined with benzodiazepines or alcohol because all three substances have sedative properties on the central nervous system, and so you may get an over-synergistic effect. Combining them can lead to excessive sedation, and obviously all the adverse effects associated with one are just simply magnified. So that's why it's not worth it. And then ginkgo biloba is considered risky for patients on anticoagulants because it can increase the risk of bleeding. So ginkgo has antiplatelet properties, which can enhance the anticoagulant effect and raise the risk of bleeding, especially if someone's going to be on SSRI. So CYP450 inducers and inhibitors. What does it mean if a supplement induces the enzyme, inhibits the enzyme? Grapefruit juice is the big vendor here. Medications like benzos, because it contains compounds that inhibit certain CYP450 enzymes, particularly in the 3A4 pathway. This enzyme is responsible for the metabolism of many drugs. When grapefruit juice inhibits the 3A4, it can lead to decreased metabolism of the drug, and those substrates of this enzyme result in higher blood levels of the drug. Quetiapine is most commonly metabolized through 3A4, so when you add the grapefruit juice, you will have more sedation. So given the risk for potential quetiapine levels to go up, we generally advise against grapefruit juice. So let's finish this up here. So if patient asks, are supplements effective for mental health, and how should you respond? And how do placebo effects complicate the research on nutraceuticals? Because it doesn't go away, neither do nocebo effects. CYP450 enzyme interactions in drug metabolism are crucial. Supplements in foods like grapefruit juice can alter drug levels, inhibiting or inducing these enzymes. So this knowledge can help you managing potential drug-food interactions and drug supplement interactions. Supplements in mental health, while some may offer some benefit, you have to realize we don't have the same type of robust studies that we have with the sample sizes and long trials. It's important to approach supplements with caution and always consult a healthcare provider, especially given the variability in individual responses. And don't ever underestimate the placebo effect. It's a significant factor in nutraceutical research as well. And then people go on with their anecdotes and claims and swear up and down by them. So this is important to know that it may work, but it also might just be a placebo effect. So that's all for today. Hope you found that informative. Sorry for the background noise.